From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
November is National Lung Cancer Awareness Month, and not enough people know that it is one of the most common cancers, since it is very often a least talked about cancer. It is also very important to note that not all lung cancer is the direct result of smoking, but a great deal of it is. Dr. Gupta is live this morning here in the studio with us with some of the causes and effects and the things that people need to be aware of. We say lung cancer and we automatically make the link to smoking. It may not be the overall cause, but it's the most preventable cause. It is one that for every case of a smoker who presents, this is someone who very likely could have reduced, at the very least, his or her lung cancer risk if they just quit smoking. It's that simple.
Right. I think that's one message that needs to be clear. We do know smoking causes lung cancer, and I hear that a lot from patients who don't want to face that reality. And I think that's part of the reason there's a lot of stigma with lung cancer. You don't see the marches and the ribbons and all of that you see with breast and prostate cancer, because there's a stigma attached to it, in the sense that, you know, you sort of, people think they did it to themselves.
This is something I did to myself.
So one of the things I try to do actively is outreach to young adults to get the message across that if you shouldn't start smoking, and if you do smoke, you need to stop immediately. Not only is it an economic and healthcare issue overall nationwide, but it takes a real personal toll. And the number of strides we've made in the treatment of lung cancer is enormous over the last few years. But frankly, survivals are still not that great. So the best thing you can do for yourself is stop smoking.
We talk about early detection in a lot of other cancer as being the key to survivability. It is here as well. The problem is it is very often hard to find lung cancers early in their treatable stages.
Right. We don't have screening tools for lung cancer like we do with prostate and breast cancer. There are really no good screening tools, and unfortunately, generally by the time we find it, it's already in somewhat of an advanced stage.
We talk about smoking. There are other causes, environmental things, secondhand smoke, but it all goes back to that cigarette, that cigar, or that pipe.
Right. Secondhand smoke is another issue too, but yes, by far and away, smoking is the biggest cause of lung cancer. Even if you eliminate the rest of them, they're still a minor causative agent. So, you know, not only is it an economic cost, it's a healthcare issue, it also takes a great personal toll to get through the treatments for lung cancer. And frankly, it causes wrinkles. So for no other good reason, stop smoking.
If we have to appeal to your vanity, we are happy to do that, just to get you
to stop.
To quit smoking. It is that simple. Dr. Gupta, thank you so much. It's always a pleasure to have you join us. For more information, go to raddocs.com. That is Dr. Gupta's practice.